Welcome to the BACCH-BACAPH NHS Long-Term Plan Improving Services series. This module covers the life course pathway approach to promoting and protecting health throughout a lifetime. Ideally, it should be completed after the mini-module entitled Understanding Health and Disease. Before we start, let's just recap some of the NHS Long-Term Plan key points relevant to life course pathways. The first thing to say is the NHS Long-Term Plan was produced in advance of the consultation document entitled Advancing Our Health Prevention in the 2020s. However, the NHS Long-Term Plan uses the word prevention at least 35 times, and therefore prevention is considered an important part of service delivery in the future. The NHS Long-Term Plan does talk about population health management, which is all about tackling the determinants of health that coexist with a wide range of clinical conditions, and after ideal clinical management, tackling health determinants is the next step to improving outcomes and equity. An understanding of the life course pathway is essential for population health management. Prevention is an often overlooked or understated component of clinical service provision. The outcomes of life course pathways represent a cumulative approach to many small, ideally evidence-based interventions over a long period of time. The most obvious example would be the management of type 2 diabetes, where it is fundamental to address obesity, a calorie-rich diet and possibly lack of exercise at an individual level, whilst advocating for policies to tackle the obesogenic environment at a population level. The Understanding Health and Disease mini-module presented a reasonably static understanding of disease causation, whereas the life course pathway approach is more dynamic, health-orientated model. This module will cover the mechanism of action of health determinants, how to influence lifestyles and wider determinants, and a practical framework for structuring interventions to improve health. This is the figure that appears in the NHS Long-Term Plan describing the importance of the wider determinants of health and the relatively small contribution of clinical care to overall outcomes as judged by length and quality of life. In some ways, the orange arrows represent a very simple life course pathway, with health factors including the physical environment, social and economic factors and individual behaviours influencing quality of life along the way. Please do Google County Health Rankings Model for an excellent interactive resource based on the structure of this figure. Understanding health and disease is an essential prerequisite to understanding life course pathways. The Dahlgren and Whitehead model is an excellent, easy to understand representation of the interaction between individual lifestyle factors, social and community networks, and other wider general determinants of health, including socioeconomic, cultural and environmental conditions, all of which interact to create either health or disease. While it is visually appealing, it is difficult to translate into a practical everyday strategy at a grassroots level. More recently, these circular diagrams have become more popular. This diagram combines the Dahlgren and Whitehead determinants with the Sustainable Development Goals circulating the childhood nurturing domains in the centre. Again, the amount of information is somewhat overwhelming and difficult to translate into practical plans at a clinical level. So let's go back to basics. The traditional public health model considers the interaction between an agent, usually the cause of the disease, with the host who experiences the disease, and with the environment which may help or hinder the expression of the condition. More recently, the flip side of this pathogenic model, namely a salutogenic model, considers all the factors that can promote health rather than cause disease. All I have done here is to disentangle the elements of the Venn diagram, because I hope this will help understanding of the table that follows. Once again, we have a mini life course pathway on the left, with the factors pre-injury, at the time of injury and post-injury on the vertical axis, with the agent, host and environment on the horizontal axis. The factors in each of the cells can be divided into those that the individual has some control over, which I will call lifestyle factors, factors that are outside the immediate control of the individual, which I will call health determinants that operate on a population basis, and finally services. This diagram attempts to describe the interactions between determinants, generally acting at a population level, with lifestyles of individuals, both then combined with services. The combination of largely negative determinants and lifestyles will result in ill health, whereas the combination of positive determinants creates better health. Services can interact either at a population level, for example screening or immunization programs, or at an individual level through health education or proactive individual clinical management plans. The interaction between determinants and lifestyles can be represented by the interaction between macroeconomic and microeconomic factors. For example, living on a minimum wage limits your choices for nutrition or leisure. Likewise, quality of housing or overcrowding may limit choices for healthy lifestyles. There is no internationally agreed taxonomy for what are often called the social determinants of health, and there are many different ways of representing the interaction between the wider determinants of health that operate at a national level, for example economic or social policy, with the more local determinants, for example access to work or education, down to the behaviour of individuals and lifestyle choices. This diagram is from the World Health Organization and shows the macro factors on the left, the intermediate or meso factors in the middle, and the lifestyle factors on the right. The health system refers to an integrated health system relating to all organizations that contribute to health. The purpose of this slide is to emphasize the importance of synergy and alignment between all of the parts. So, for example, improving school readiness requires a national investment translated into quality preschool childcare, local support for vulnerable families, and home-based literacy programs involving parents. This complexity can be reduced to a tabular form when planning local services. In this example, interventions relating to the child, the community or the society are on the vertical axis, with positive and negative interventions relating to lifestyles, determinants or services on the horizontal axis. It is useful to give some thought to the mechanisms of action of health determinants when planning life course pathways, since exposure to some factors in childhood have their effects in adulthood. The life course model proposes that the exposure to positive and negative health factors throughout life have differing cumulative effects depending on pre-existing biology, the size and duration of the exposure, and then the subsequent pathological interactions leading to either health or ill health. Further exposures then determine the long-term impact of the condition on, say, quality of life. An example may help here. Let's think about rickets. Children with dark skins born in the northern hemisphere are at a biological disadvantage from birth. This vulnerability can either be exacerbated or bettered with the exposure to a diet rich or poor in vitamin D and calcium. Additional exposure to sunlight will help metabolize more vitamin D and potentially correct biochemical rickets. Continued absence of sunlight or poor nutritional intake will result in osteomalacia. If not recognized, limb deformities will result, and again, without intervention, will result in gait anomalies and difficulties with ambulation. The point here is that there are multiple points for prevention relating to different health factors that operate at different times across the life course pathway. For those of you with more visual brains, I've tried to take the concepts of the last table and design a diagram. In the center in blue is a life course pathway. It starts with biological potential and, depending on exposure to health factors, may become either susceptible or resilient to the effects of further health factors which may result in an altered health status, either for the better or for the worst. Further interaction with health factors then decides ultimately whether there are positive or negative health outcomes. On the left-hand side in green is a virtuous cycle with exposure to positive determinants throughout the life cycle resulting in good health. This process is salutogenesis. On the right-hand side in red is the vicious cycle with exposure to negative determinants resulting in poor health and poor outcomes. This is a pathogenic cycle. Life course pathway thinking is therefore merely a way of describing the influence and interaction between determinants over the course of an individual's life. It is particularly useful during childhood as different determinants have a disproportionate impact at different stages of a child's growth and development. The influence of determinants within the life course pathway has been conceptualized in 4 different ways. A single critical period model, for example, lack of folate. A critical period model with later effect modifiers, for example, infant language development. Accumulation of risk with independent and uncorrelated hazards, for example, injuries. Or the accumulation of risk with correlated hazards, for example, risks associated with poverty. Another way of visualizing these concepts is to use a growth chart with quality of life on the vertical axis and age on the horizontal axis. The circles represent determinants, lifestyles and services over 6 time periods. Exposure to positive health factors creates a trajectory on the upper curve, whereas exposure to negative health factors creates the lower curve. This then introduces the concept of equity and a quality life years gap between the upper and lower curves. Factors that have a negative impact on health are generally called hazards, whereas factors that have a positive impact are called assets. On the left-hand side are the hazards relating to lifestyles and determinants, whereas on the right are the assets that relate to lifestyles and determinants. Adverse childhood experiences, or ACEs, are stressful or traumatic events occurring any time throughout childhood, and include all forms of abuse and neglect, as well as parental mental illness, substance misuse, divorce, parental imprisonment or domestic violence. Adverse child experiences should be complemented by positive childhood experience, but as yet the concept has not been established, so I have included FACEs, which are favourable childhood experiences covering good events in family lives, as a reminder. Now let's look at how you might influence lifestyles and determinants. Priority setting and economics will be the topic of a separate mini-module. But when deciding on policy priorities, a number of factors will need to be considered. For example, the burden of disease within the population, the evidence base for the interventions, the number of children or families affected, the practicalities of delivering a practical strategy, the overall costs and value, and public acceptability, to name but a few of the criteria. Generally, policies that can be applied to populations that do not require significant behavioural change and are cost-effective have the most effect. Fluoridization of water to prevent dental caries would be an ideal example. Changing the behaviours of individuals is far more challenging, for example, stopping smoking or improving diet. Policy interventions backed by legislation and regulation are generally the most effective strategies to promote health and reduce inequalities at a society level. Sugar taxation is a recent example of changing dietary habits through a fiscal intervention. Legislation to reduce traffic speed not only reduces the severity of road traffic injuries, but also reduces carbon emissions. Redistribution of wealth through regressive taxation policies or the provision of services like free school meals attempts to address inequities. Provision of information, whether this be the nutritional value of food or efficiency ratings of refrigerators, are all part of a nudge strategy to change choices for the better. Last but not least are the values that people experience in their day-to-day lives. In this world of social media, celebrity behaviour can have a disproportionate impact on the behaviour of others, whether this be Dominic Cummings or Marcus Rashford. This slide represents the life course pathway in purple in the centre. The long continuous boxes on the left in red represent high-level policy initiatives on a national basis concerning economics, the environment, values in society and access to public services. They are generally outside the control of individuals, they change slowly and are generally in operation throughout an individual's life. The more individual downstream interventions are listed on the right in green. Interventions might include everything from improving housing stock, reducing crime, improving the natural environment, and greater access to locally produced foods. When planning interventions locally, it's important to create a synergy between the various strands in order to maximize effect. policy includes all actions with a clear purpose, ranging from legislation and regulation at a national level, through to workforce and research priorities down to therapeutic interventions in clinical settings or health education activities in school settings. This diagram attempts to show policy being enacted within an integrated health system, influencing health factors within determinants and lifestyles. Health policies related to screening and immunisation are delivered on a population basis, whereas health education to tackle individual health factors is generally undertaken on a one-to-one basis. Clearly there is an overlap, and it's important that individual policies are congruent with one another for maximum effect. Changing individual behaviours is far more problematic, but that is not to say that change is impossible, just challenging. Individual behaviours are hugely influenced by family norms and peer behaviour, both of which are often influenced by the wider determinants of health, for example poverty limiting healthy choices. Choice behaviours are however amenable to change, as evidenced by huge advertising budgets for companies promoting alcohol consumption, confectionery or gambling. Health promotion budgets within health services are minuscule in comparison. But unhealthy behaviours are amenable to change, as evidenced by cognitive behaviour therapy. There is increasing interest in a program called Making Every Contact Count within health service consultations to tackle health determinants and lifestyles. Making Every Contact Count has not yet spread into services for children, but it does have a sound evidence base and an accompanying NICE guideline. The Behaviour Change Wheel is central to this process. The Behaviour Change Wheel recognises that first individuals need to be motivated, then capable of making changes as opportunities arise, and all three elements must come together if there is any chance of a sustainable change. For example, a single parent must first recognise her child is overweight, and then may need to tackle her social isolation and mild depression before taking up the opportunity of a local food co-op and tackling her child's obesity. Now let's take all this theory into practice. We will concentrate here on a local rather than a national policy initiative. Having decided on a topic through a robust priority setting process, the next step can be a brainstorm. If we take burns as an example, it may be necessary to define which burns are the most important. That might be hot drinks burns to infants, open fire burns to toddlers, or house fire burns affecting all ages. Include causation and prevention, and then allocate the areas to individuals, communities, or services. The following table might help. On the vertical axis is the child, their family, and the community, and each of these can be further subdivided as required. Services are included, and the negative column is included merely for completeness to recognise that services do sometimes have a negative impact, such as creating anxiety or contributing to climate change. This table can be used in a number of different ways, for example, laying out the evidence base, determining who is responsible for commissioning services, who is responsible for providing services, and indeed where leadership lies. The majority of interventions require individual families to take action in their own homes, including the use of fire guards, preventing hot drink spills, using smoke alarms, and reducing hot water temperatures. Health determinant factors would include fire resistance of children's clothes, regulation to reduce hot water temperature, and building codes for central heating systems. The health service contributes by providing burn care, health education advice through the Healthy Child programme, and relevant burn data to set priorities and monitor the impact of interventions. Health or disease is created through the interaction between agents, a host, and the environment. Each can be either positive or negative in their effects. Health factors operate at the level of individuals or populations. Those operating at an individual level have been called lifestyles, whereas those at a population level are called determinants. A life course pathway approach describes the contribution of various health factors throughout the life on the overall duration and quality of life. Interventions can be grouped into those intended to protect individuals from hazards and those used to promote positive factors or health assets to improve health. It is essential that intervention programs are congruent with one another and interact in ways that are mutually reinforcing. Finally, don't forget equity of outcomes. Now don't forget to read the accompanying paper on life course pathways, and then go on to the next mini module, which is population health management.